Hello and welcome to our Gold participants. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for Gold Lactation Online Conference 2016. Well, welcome. We have Elizabeth Myler here with us today. Very excited to have you, Beth. How are you doing?
I'm doing wonderful. Thanks for having me, Fiona.
And I have to let everyone know that Beth is on a very busy schedule these days, doing lots of amazing and wonderful things. So we're very excited to have her, that she's been able to carve out some special time for us here at Gold and bringing us a phenomenal topic. I have to say this is a packed full presentation. So when you come and join us at Gold this year, you'll need to use that pause button a lot. Take lots of notes. I already got the sneak peek, so I'm just letting you all in to let you know about that. So the presentation is titled Wound Care for Gnarly Nipples, What, Why, When to Treat. And again, this is a topic that comes up over and over again. I was actually on with my local LCs this morning, Beth, because they're asking about certain things that we've been using for a long time, and you know, all those things. I'm not going to give too much away because I know you're going to talk about it, but I want you first of all just to go back to the beginning, if you wouldn't mind introducing yourself to all of those who haven't met you yet, and then tell us what prompted you to get into researching treatments and protocols for wound healing.
Sure, I'd love to. So I'm Beth Myler, and I am an IBCLC registered nurse also in northern New Jersey in the United States. And I've been practicing since about 2009, and I have a private practice and breastfeeding center here. And I think that I'm always looking to share with my colleagues something that's value added. And I think that we all know that pain and wounds are sort of one of the bread and butter things that we deal with as LCs. So I was asked a year ago to just do a short presentation about wound therapies for a clinical day for my colleagues in private practice, and then the following year was asked to come back and give a full 75-minute presentation on the topic. So I had a wonderful co-speaker and researcher, Leslie Stern, and together we put this together, and I'm very grateful for Leslie's assistance with this too, and I want to give her full credit as well for the information that you will be hearing.
Well, that's wonderful. Well, thank you for doing that. It seems that not only is this a passion of yours, Beth, and Leslie's, but you really, I mean, I've seen that presentation, so I have to speak from my own experience. It was amazing. You're just so... your delivery of this information is wonderful. It just really puts it into context exactly what's happening out there, what we've been using for a long time, what's new in the market field, and you know what the results are. So I really appreciate, you know, all the time and effort that you've definitely put into this. So it shines through, your passion shines through when you're teaching on this. It's just phenomenal. Okay, let's get on to another subject here. I want to know a little bit about some historical factors, because one of the things that we're doing here, of course, is celebrating at Gold Lactation. It's our 10th anniversary, Beth, and we're just
congratulations.
Thank you. It's a big milestone, you know, and we're celebrating all this season. We've got a great conference coming up, and we just want to have that sort of celebratory type of feel to everything in just talking about life and those types of things. And we're also reflecting on all the changes that have happened in the field of lactation. So if you just want to give us maybe a little synopsis of, you know, what you've seen in your time in the last 10 years, what great changes, maybe things that haven't changed that you want to see change even more, but just share a little bit with our listening audience today about those things.
Well, I think it's a fascinating question, and we hear a lot that our field of lactation consulting is still sort of a baby field, you know, and so, you know, we're maybe not in our infancy, but we're still in toddlerhood, and that means that we're still formulating, you know, some of the methods with which we need to approach our clients' problems. And I think that I have to say, in the past 10 years, I think we've really moved from a layperson's mother-to-mother support to a much more, frankly, complex and medicalized care system. And so I think that that's really reflected in part by how much information moms have access to now. You know, everybody's, we say they're Googling it, you know, before they see us. So we have to be on top of our game and really, really very well aware of the many different options that moms have for looking to treat themselves and diagnose themselves. So we have to be a step ahead of what they're seeing so that we're able to break this information down for them and share with them the evidence-based treatments.
Yeah, I find that a really good point. It's really being, like you said, ahead of them and engaging within those conversations too. And it's absolutely true. For the longest time, I think there was a little bit resistance. I know inside of myself there was, Beth, in terms of just being in that mix because, you know, why take the time to sort of see what the myth types of treatments that were being spoken about. But if I can't engage with my client where she's exactly at, then that doesn't give me an opening, I feel, to, you know, really discuss the things that are working or are evidence-based. So I've found myself now engaging at a deeper level with, you know, all of those mommy groups, our birthing groups, our breastfeeding groups, just to kind of hear what are you guys talking about? It's great, and it's just been one of those ways. Yeah, it's been one of those ways to really engage with those moms. So we used to do that all face to face, you know, before we were Googling things. But I think we do need to be savvy, like you said, and be online with them and see what they're talking about. So that's a really, really great point. I love that so much. I take that to heart for sure. So,
and deep down, I think that moms, although they have access to a lot of information, they still are yearning for a voice of someone that is able to break that information down and help them make the right decision for their particular problem and their particular baby. So we can fill that much needed gap.
Oh, for sure. I mean, at the end of the day, it's that compassionate ear, that reflective listening, you know, that pays off, I think, in volumes, because we all want to be heard, you know, in all walks of life. But with that mama who's so vulnerable post-birth, you know, she needs you there by her side and you know, reflecting on what she's saying to you.
Absolutely.
So moving on just to the last question I have for you, which of course we tap into all of our speakers about this, but just briefly, could you just tell our listening audience today what they have to look forward to and what you're looking forward to sharing with them about your actual presentation, Beth?
Well, I'm afraid I'm going to give the punchline away away, and I will do that because I don't want anyone to assume going into this that I am going to tell them the one perfect wound care treatment, because the punchline is that there isn't just one. So what I hope is that everybody will learn a little bit more about the different categories of wound therapies and really learn how to better classify and chart and describe the different types of wounds so that we can speak intelligently with our other clinician collaborators, you know, physicians and other clinicians who are also working with babies. So to give everybody a little bit of language for their ever important charting and to really try and categorize some of these wound therapies for individual circumstances.
Well, that sounds fantastic. Can't wait to hear the full presentation, and I can't wait to share it with everyone here at Gold Lactation. So thank you so much, Elizabeth Myler, Wound Care for Gnarly Nipples, What, Why, When to Treat. Thank you so much, Beth, for sitting down with us here today. It's been great having you.
Thanks, Fiona.
And to our listening audience, we look forward to having you again, but it's time to say goodbye for now.